Drugs and drugs abuse in relation to nervous coordination. Drug abuse can affect the nervous coordination of an individual in various ways depending on the type of drug and the frequency of use. Some drugs such as cocaine, amphetamines, and caffeine can stimulate the central nervous system, leading to increased alertness, arousal, and heightened reflexes. This can result in a temporary increase in nervous coordination, but can also lead to overstimulation and hyperactivity in the short term, and potentially long-term damage in the form of nervous system disorders. Other drugs like opioids, sedatives, and tranquilizers can depress the central nervous system, leading to slower reflexes, decreased coordination, and impaired motor function. Over time, this can lead to addiction, cognitive impairment, or other neurological damage. Long-term drug abuse can also affect the brain's ability to adapt and regulate the body's nervous coordination through the development of physical and psychological dependencies. Nervous coordination can also be affected by the various withdrawal symptoms that occur when an individual tries to stop using drugs abruptly. Therefore, drug abuse can have a detrimental effect on the nervous coordination and overall health of an individual, leading to both short-term and long-term consequences. Definition of drugs and drugs abuse. Drugs are chemical substances that can be natural or synthetic and are used to alter the way the body functions. They can be used for medicinal, therapeutic, or recreational purposes. Drug abuse, on the other hand, refers to the excessive and harmful use of drugs beyond their intended purpose, which can result in physical, psychological, and social harm. Drug involves the use of illegal drugs such as cocaine, heroin, or methamphetamine, but it can also include the misuse of prescription medications or over-the-counter drugs. Drug abuse can lead to addiction, cognitive impairment, and negative consequences in a person's personal and professional life. It can affect an individual's physical and mental health, relationships, and ability to function normally in society. Psychoactive drugs. Psychoactive drugs are substances that affect the brain and alter an individual's mood, perceptions, thoughts, or behaviors. They can be natural or synthetic, legal or illegal, and are often used for various purposes such as medical, therapeutic, or recreational purposes. Psychoactive drugs can be classified into different categories such as 1. Stimulants. These drugs increase brain and bodily activity and can include drugs such as caffeine, nicotine, cocaine, and amphetamines. 2. Depressants. These drugs slow down brain and bodily activity, and can include drugs such as alcohol, opioids, and benzodiazepines. 3. Hallucinogens. These drugs alter perceptions of reality and can include drugs such as LSD, mescaline, and psilocybin. 4. Dissociatives. These drugs can cause a feeling of detachment or disconnection from reality, and can include drugs such as ketamine and PCP. 5. Cannabis. These drugs have a psychoactive effect due to the presence of THC, and can include marijuana and hashish. The use and abuse of psychoactive drugs can lead to a range of physical and psychological effects, including addiction, cognitive impairment, and negative impacts on personal and professional life. Forms of drug taking. There are several ways individuals consume drugs. Here are some common forms of drug taking. 1. Oral administration. This involves ingesting the drug through the mouth, such as in the form of a pill, capsule, or tablet. The drug is absorbed through the digestive system and transported to the bloodstream. 2. Smoking. Some drugs, such as tobacco, marijuana, and cocaine, can be smoked. The drug enters the bloodstream via the lungs and the effects are felt relatively quickly. 3. Inhalation. Inhalation involves inhaling the drug through the nose or mouth, such as with certain prescription medications or inhalants like nitrous oxide. 4. Injection. Some drugs can be injected directly into the bloodstream using a needle and syringe, like heroin or certain prescription drugs. 5. Topical application. Certain drugs can be applied topically to the skin or mucous membranes, such as patches or creams for pain relief. The method of drug taking can affect how quickly and intensely the drug takes effect and can also impact the risk of addiction and negative side effects. It's important to understand the risks associated with different forms of drug use and to avoid any form of drug taking that could lead to harm. Drug abuse. Drug abuse refers to the use of drugs in a manner that is harmful or goes beyond what is necessary for medical purposes. It is essentially the misuse of drugs, which can lead to a range of negative consequences. Drug abuse can involve both legal and illegal drugs, including prescription medications, over-the-counter drugs, and illicit substances like cocaine, heroin, and methamphetamine. The misuse of drugs can lead to addiction, which is a chronic and relapsing disease characterized by compulsive drug seeking and use despite the harmful consequences. Drug abuse can have a range of negative physical, social, and mental effects, including overdose, illness, loss of relationships, financial problems, impaired work or academic performance, and increased risk of accidents or injuries. It can also lead to legal problems, including arrest and imprisonment. Seeking professional help is recommended for individuals who are struggling with drug abuse or addiction. Types of drug addiction. There are various types of drug addiction, depending on the specific substance that the person is addicted to. Here are some common types. 1. Opioid addiction. Opioid addiction involves the misuse of prescription painkillers or heroin. Opioids are highly addictive substances that can lead to physical and psychological dependence. 2. Stimulant addiction. Stimulant addiction involves the misuse of drugs such as cocaine, amphetamines, and methamphetamine. Stimulants can produce an intense high and can cause addiction with repeated use. 3. Sedative addiction. Sedative addiction involves the misuse of drugs such as benzodiazepines, which are used to treat anxiety and sleep disorders. These drugs can be highly addictive and can cause withdrawal symptoms when use is reduced or stopped. 4. Hallucinogen addiction. Hallucinogen addiction involves the misuse of drugs such as LSD, mescaline, and psilocybin, which can cause altered perceptions and hallucinations. While these drugs are not typically considered physically addictive, they can be psychologically addictive. 5. Inhalant addiction. Inhalant addiction involves the inner, or aerosols, which are inhaled to produce a high. Inhalants can be highly dangerous and can lead to serious health problems. Each type of drug addiction may require different approaches to treatment, but all types of addiction can benefit from therapy, medication, and support groups. If you or someone you know is struggling with drug addiction, it's important to seek help from a qualified healthcare professional. Reasons for taking drugs. There are various reasons why individuals take drugs, including 1. Curiosity. People may experiment with drugs out of curiosity, wanting to experience their effects. 2. Peer pressure. Social pressure can lead people to try drugs. They may feel like they need to fit in or be accepted by a certain group. 3. Self-medication. People may use drugs to self-medicate when they are dealing with issues such as anxiety, depression, or chronic pain. 4. Escapism. People may use drugs as a way to escape from stress, trauma, or other difficult emotions. 5. Addiction. Repeated use of drugs can lead to physical and psychological dependence and eventually addiction. 6. Cultural or religious reasons. In some cultures or religions, drug use may be accepted or even encouraged for ritualistic purposes. 7. Recreational use. Some people use drugs for recreational purposes, to enhance their social experiences, or to feel a sense of euphoria and pleasure. It's important to note that drug use can have serious negative consequences on a person's health, relationships, and overall well-being. If you or someone you know is struggling with drug use, it's important to seek help and support from a qualified healthcare professional. Effects of excessive use of drugs. Excessive use of drugs can have various negative effects on a person's physical, mental, and emotional health, including 1. Physical health. Drug use can cause damage to various organs and systems in the body, including the heart, lungs, liver, kidneys, and brain. Chronic drug use can also lead to diseases such as cancer, HIV, and hepatitis. 2. Mental health. Drug use can cause or worsen mental health issues such as anxiety, depression, psychosis, and cognitive impairment. It can also lead to increased risk of suicide and self-harm. 3. Addiction. Repeated drug use can lead to addiction, which is characterized by an uncontrollable urge to seek and use drugs despite negative consequences. 4. Social and economic consequences. Drug use can lead to strained relationships, loss of employment or financial stability, and legal problems. 5. Overdose. Excessive drug use can lead to overdose, which can cause permanent damage or death. It's important to seek help and support if you or someone you know is struggling with drug use. Treatment options include therapy, medication-assisted treatment, and support groups. Measures to control drug abuse. There are various measures that can be taken to control drug abuse, including 1. Education and awareness. Educating the public about the risks and consequences of drug abuse can help prevent drug use and promote healthier choices. 2. Prevention programs. Implementing prevention programs in schools, communities, and workplaces can provide resources and support to individuals at risk of drug use. 3. Treatment and rehabilitation. Offering accessible and effective treatment and rehabilitation programs for individuals struggling with drug addiction can help reduce drug use and improve overall health outcomes. 4. Law enforcement. Enforcing laws and regulations around drug use, trafficking, and sale can help reduce the availability of drugs and deter their use. 5. Support groups. Encouraging and providing resources for support groups for individuals and families affected by drug abuse can help individuals overcome addiction and maintain abstinence. 6. Harm reduction strategies. Implementing harm reduction strategies such as syringe exchanges, overdose prevention programs, and safe injection sites can help reduce the negative consequences and risks associated with drug use. It's important to have a comprehensive and collaborative approach to addressing drug abuse that involves the participation of multiple sectors and stakeholders, including healthcare professionals, law enforcement, policymakers, and the community. Revision questions with answers. 1. Distinguish between a. Sedatives and stimulants. B. Physical and psychological addiction. 1. Sedatives are drugs that slow down the central nervous system, reducing brain activity and causing relaxation and drowsiness. Examples of sedatives include benzodiazepines, barbiturates, and alcohol. Stimulants, on the other hand, increase brain activity, causing heightened alertness, energy, and focus. Examples of stimulants include caffeine, nicotine, and amphetamines. 1b. Physical addiction is a state in which the body has adapted to the presence of a drug, requiring increasing amounts of the drug to achieve the same effect and causing withdrawal symptoms when the drug is stopped. Examples of drugs that can cause physical addiction include opioids, alcohol, and benzodiazepines. Psychological addiction, on the other hand, is a state of intense emotional and mental dependence on a drug, characterized by craving and compulsive drug-seeking behavior. Examples of drugs that can cause psychological addiction include nicotine, cocaine, and methamphetamine. 2. State 5 effects of drug addiction. Drug addiction can have a variety of effects on an individual, including 1. Health problems. Drug addiction can cause a range of physical and mental health problems, including heart disease, liver damage, respiratory illness, mental health disorders, and cognitive impairment. 2. Relationship issues. Drug addiction can strain and damage relationships with family, friends, and romantic partners, leading to social isolation and conflict. 3. Financial problems. Drug addiction can be expensive, both in terms of the cost of the drugs themselves and the associated legal and medical costs, which can lead to financial instability and hardship. 4. Legal issues. Drug addiction can result in involvement with the criminal justice system, such as arrests and incarceration, as well as other legal problems such as fines and community service. 5. Impaired decision-making. Drug addiction can impair an individual's ability to make sound decisions, leading to poor judgment, risky behavior, and negative consequences across various areas of life. 3. Outline the causes of drug addiction. There is no single cause of drug addiction, as it is the result of a complex interplay between various biological, environmental, and psychological factors. Some of the key causes of drug addiction include 1. Biological factors. Genetics, brain chemistry, and other biological factors can increase the risk of developing drug addiction. 2. Environmental factors. Environmental factors such as early life stress, trauma, poverty, access to drugs, and peer pressure can increase the likelihood of drug addiction. 3. Psychological factors. Mental health disorders such as depression and anxiety, as well as personality traits such as impulsivity and sensation seeking, can contribute to drug addiction. 4. Social factors. Social factors such as peer pressure, cultural norms around drug use, and social isolation can also contribute to drug addiction. 5. Developmental factors. Early exposure to drugs, as well as disruptions in brain development and social development during adolescence, can increase the risk of developing drug addiction. 4. Explain possible remedies to prevent drug abuse. There are several possible remedies to prevent drug abuse, including 1. Education and awareness. Educating individuals, especially young people, about the dangers of drug abuse and addiction can help prevent drug use by increasing awareness of the risks and consequences of drug use. 2. Access to treatment. Providing access to treatment for drug addiction, such as detoxification programs and behavioral therapies, can help individuals overcome drug addiction and prevent relapse. 3. Prescribing practices. Healthcare providers can help prevent drug abuse by prescribing medications responsibly and monitoring patients closely to prevent misuse and abuse. 4. Law enforcement. Law enforcement efforts to reduce drug trafficking and distribution can help limit access to drugs and deter drug use. 5. Community support. Providing social support and resources, such as job training and mental health services, can help individuals address the root causes of drug addiction, such as poverty and mental illness. 6. Harm reduction strategies. Implementing harm reduction strategies, such as providing clean needles for injection drug users, can reduce the spread of diseases and prevent overdose deaths. 5. Suggest how students in a school can play a major role of preventing and controlling drug abuse. Students in a school can play a major role in preventing and controlling drug abuse by 1. Being informed, learning about the risks and consequences of drug abuse, as well as the signs of drug use, can help students identify and avoid drug use. 2. Peer support, supporting peers who may be struggling with drug use, providing them with guidance and resources, and encouraging them to seek help can prevent drug use from escalating. 3. Advocating for drug-free activities, encouraging activities and events that are drug-free, such as sports tournaments, cultural events, and volunteer projects, can promote a healthy and positive school environment. 4. Creating awareness, organizing campaigns and events to create awareness and disseminating accurate information about drug use can promote conversation and lead to changes in attitudes towards drug use. 5. Reporting suspected drug use. Reporting any suspected drug use to school administration, teachers or counselors can help prevent drug use from becoming a more significant problem. 6. Role modeling positive behavior. Demonstrating positive behaviors, such as staying drug-free, exercising regularly, and engaging in healthy social activities, can encourage others to follow suit and support a drug-free school environment.